smiling face.
Welcome back. I'm Dr. Margaret Ames, and you're listening to Your Dental Health. I can be reached in my office at 631-261-4525. Today we're talking about crowns or caps. But let me tell you about fear of the dentist. That really doesn't happen in my office. Everybody's welcomed like they're a guest in my home. But one of my patients sent me an article about a boy in France, in Saint-Gervais, in the Alpine village. He's 12 years old. He faked his kidnapping so he wouldn't have to go to the dentist. He told the police, he gave him a complete description of the kidnapper and what the car was like. Police spent a month investigating his kidnapping, and then he came up with the truth, which is, I was afraid to go to the dentist. Now, that doesn't happen in my office. And when people tell me that, they're afraid to go to the dentist, I say, well, you're in the right place. There's no need to be afraid. We're going to stop whenever you ask me to stop. If you raise your left hand, I'm going to stop no matter what I'm doing. I want you to be as comfortable and in control of the situation as you possibly can be. It allows everything to flow better. If you need a break, I'll give you a break. We have hot towels. We have a bolster to put behind your knee so that your back is more comfortable. We give you breaks to stand up, walk around. It's really a wonderful experience. We know everybody by name. You almost don't even have to have a chart. We know your history. So back to crowns. A patient walked in one day. He called. He said, I have an emergency. My crown fell off. Can I get in today? So, of course, you think, this isn't going to take long. I'll make sure there's no decay in the tooth that's remaining, and I'll cement the crown back on for him. So he handed Bonnie the crown, and she put it into the ultrasonic cleaner, and she said to me, Dr. Ames, there's stuff inside that crown. It's just not the crown. There's something else there. It looks like his tooth broke. Bonnie's been with me for 20 years. She really knows her dentistry. So I'll look at the tooth and I'll say, wow, what are we going to do now? The tooth actually broke. The crown looks as good as the day it was placed, which I don't know when that was because I didn't do it, but the crown looks wonderful. It's stable. It's like that old 54 Chevy I talked about last week. The Chevy stayed viable, whereas now the crown, the cars that are in collisions, they have crumple zones. The car gets ruined, but the passengers stay alive, the central part of the car. So in this particular tooth, and many, this is not an unlikely scenario. The whole crown broke off below the level of the bone. How sad is that? One of the reasons is because a rigid structure, this was porcelain fused to metal, which is really rigid, was placed on a flexible structure, which is a tooth. I think of a tooth as having, like at the gum line, that's like the waist of the tooth, where it can bend back and forth. So if you it's like putting a ski helmet on, or a motorcycle helmet on, without any cushioning. Those helmets are designed so that if you have any trauma to them, there's a little bit of cushioning built inside. Well, modern crowns, they can't have that. There's no way to put that cushioning in there. So that's something that you don't want to happen, is to have a crown. But if you have a crown, you can't unring the bell. You can't go back. So I'm here to talk to you about biomimetic dentistry, because we don't want to have complete failures of your tooth where you spiral down into a death spiral of having the tooth extracted. If a tooth is extracted, all your other teeth start to shift. So you need to either replace the missing tooth with a 3-tooth bridge, so you cut down the 2 teeth next to the space, or you put a dental implant in there and you crown that. So there's different types of failures. There's a biological failure. So in a new tooth that has bacteria in it, that's a biological failure. You want to find the disease early. We have a laser light that reads the amount of bacterial poop in your tooth. So we know, looking at that laser light, how active the decay is. If there's even decay there, does it need a sealant or does it need a small filling? The smaller the filling is, the longer it lasts. Then there's a clinical failure where you can actually see it. You can see a gross part of the tooth that's missing. And then the third type of failure is a catastrophic failure. That's when you're going to either need a root canal, which is very invasive, or you're going to need the tooth extracted. Another way of restoring an extracted tooth or replacing it is by a removable denture. And nowadays people cringe when they hear about a removable denture because they don't want to spiral down to what their parents or grandparents had. So do crowns prevent cavities? No, they just move the area where the bacteria can take up residence down further underneath the gum. Any restoration. Let me take a break now. You're listening to Dr. Margaret Ames at Your Dental Health. I can be reached at 631-261-4525. Please email me your questions and concerns at Dr. Ames at drames.com. That's drames at drames.com. I'd like to address your questions and your issues in future shows because I am so excited about biomimetic dentistry. Crowns fail. They do not last forever. The longest lasting crowns ever, and some dentists will argue this point, but they're the ones that really didn't need a crown in the first place. Maybe back then they did, before we had this advanced adhesion. You see, adhesion started in the 60s when a researcher up in Buffalo, Dr. Bonacore, started to find a way to attach a material to teeth to prevent the childhood cavities that you get in your pits and fissures. And that advanced to, maybe we can do more with this. And then there was a generation of people that came along with tetracycline. They had tetracycline as babies or tetracycline for acne, and it turned their teeth gray. Many of those people got all their front teeth crowned because their teeth looked dirty. Now we know ways of bleaching them or putting veneers on, which are a less invasive treatment. So I love doing veneers. You can make teeth look different shape. You can make them look a different color. You can make them look lined up, and even they're gorgeous. And in many cases, veneers can be placed right over your existing tooth structure without having to drill any part of it away. You see, inside a tooth, there are like microscopic cables. There's things that hold the teeth together like tie rods. When you violate those diagonal and parallel and perpendicular structural innards of the tooth, then you're going to weaken the tooth and the tooth is going to fracture. Biomimetic leaves as many of those structures inside your tooth so that nature can follow its own course. There will still be some flexibility. You don't put something that's hard and inflexible onto the tooth. So an alternative to crowns is biomimetic dentistry. If you have a tooth that you've been told needs a crown, call me, 631-261-4525. I'll be happy to give you a second opinion and explain biomimetic dentistry to you. This is the wave of the future. Why isn't everybody at my door? That's another question I've been asked. Like, this is really exciting. Why isn't everybody at your door wanting this? Well, there's no industry driving it. There's an industry called dental implants, which if 20th century dentistry were so great, we wouldn't even have that industry. But there's big money behind implants, and implants serve a wonderful need. But if you can avoid them, any conscientious dentist would say that's really a great thing. So I want to tell you about the cost of a tooth, because you'll be shocked. Back in $2,003. So there's a book called Mouth Matters, written by Carol Vanderstoep, and she quoted a Delta Dental study, a detailed study of the costs of traditional drill, fill, and bill, mercury, silver, amalgam, resin fillings. And they said, Delta Dental said, for patients who develop cavities in their molars between ages 7 and 12, who entered the repair, replace, repair cycle of traditional dentistry, each tooth costs more than $2,187 in services by age 79 per initial cavity. The lifetime costs increase when a tooth requires a root canal or extraction and replacement with a prosthetic tooth. So we want to make your visit to my office comfortable, happy, friendly. We want to listen to what your concerns are. Repair your teeth in a way that honors nature and honors the tooth, rather than having a restoration that lasts. There's even a new crown. It's been out for a few years. It's called a Bruxer crown. And it's advertised as, this crown will never fail. Well, that's pretty exciting. If you have a patient that's a Bruxer and your crown isn't going to fail, it's kind of neat because then your crown didn't fail. But where's the stress going to go? The stress is going to go to your tooth. So you can't really depend on a Bruxer crown, because if you're a grinder, you're going to break your tooth. So the best thing to do is to keep your tooth, as many of your natural tooth parts as you can. I had a patient named Ken. He said he was told he needed an implant by another dentist. He said, Dr. Ames, I just don't want to lose another body part. We have to try to make this work. That tooth is still in his mouth because of the conservative, minimally invasive treatment that I did. So I want to welcome you to my office. Thank you for listening. I look forward to talking to you next week where we'll have new, exciting concepts in dentistry. Please join me next week. Enjoy the rest of your weekend. And thank you. This is Dr. Margaret Ames at 631-261-4525, www.drames.com. Thank you.
There's something about you, baby.